Hi, good evening. My name is Lisbeth Armijos. I am going to speak about the pressures, volume, and results for transcatheter aortic valve replacement. First, we have the definition. The definition that transcatheter aortic valve replacement is a minimal invasive cardiac procedure to replace a narrowed aortic valve that can't open fully. It is flexible in the presence of aortic valve stenosis.
The aortic valve opens to let blood flow out of the left pumping chamber of the heart to the rest of your body. Aortic stenosis means that the valve becomes stiff and doesn't work properly. During some procedures, doctors guide a catheter through the femoral artery up to the aortic valve. During some procedures, they access the valve through a very small incision in the chest wall and then through the apex of the heart. Once the guide catheter was in place, the heart team deployed the new valve within the old one, restoring blood flow.
Now we have the location. The aortic valve is located between the lower left heart chamber, that is the left ventricle, and the main artery of the body, better known as the aorta. If the valve doesn't open properly, blood flow from the heart to the body is reduced. About the application in medicine, it's that transcatheter aortic valve replacement may be an option for people who are at risk of complication from surgical aortic valve replacement. Surgical replacement is better known as open heart surgery. The decisions to treat aortic stenosis with transcatheter aortic valve replacement is made after discussion with a team of heart and cardiac surgery specialists who work together to determine the best treatment options for you. About the pro, it's that the advantage that they have a very short hospital stay, unlike a surgical replacement of the aortic valve. In addition, this procedure is very necessary in diagnosis with aortic stenosis, having many positive results for the improvement of the patient's health status. About the con, we have that it has very predictable risks, which is why it is like a type of surgery, including bleeding or complication in the blood vessels. However, the patient must be informed of all the consequences that may be brought about by or after surgery, including a stroke, heart rhythm problems, heart attack, or even the death.
Industry. In conclusion, the decision to post-dilate is based on a careful risk-benefit analysis and should not be made purely based on the severity of PVL alone. One must evaluate the landing zone risk for adverse outcomes versus a successful post-dilatation.
Another term is the apply in Ecuador. Despite the high cost in Ecuador at the Teodoro Maldonado Carbo Hospital in the south of Guayaquil, the first transcatheter aortic valve implantation have been performed with strict patient selection criteria which represent no complication compared to conventional open valve replacement. The researchers set up to review the complication and survival of patients with aortic stenosis undergoing transcatheter aortic valve implantation versus traditional aortic replacement. A documentary and retrospective research was designed. The clinical literature was reviewed, especially that relate to Ecuador between the years 2010-2018. 30% of them have a very high surgical risk for conventional surgery, which mainly includes elderly patients. The last one is about the conclusion. Transcatheter aortic valve replacement is a procedure that has many advantages in the diagnosis of aortic stenosis. However, it is necessary to take into account the risks that can be incurred if there is a complication, since it is a surgery that is not 100% effective. This is how it can be used in several cases through a diplomacy of various doctors who can contribute with ideas so that the patient has a better quality of life. That's all. Thank you for your attention.